welcome. You're watching a special program tracking COVID-19 this Thursday morning with me, Nancy Kohli. First, let's begin with the top stories. Prime Minister Modi replies to the thank you note by the US President Donald Trump, says times like these bring friends closer. The Brazilian President Jair Bolsonaro also thanks Prime Minister Modi. Extraordinary measures initiated to arrest the corona outbreak. Uttar Pradesh seals hotspots in 15 districts, while Madhya Pradesh orders 3 districts, that's Bhopal, Indore and Ujjain, completely sealed. No movement allowed. Essential services to be provided by the government. 20 corona hotspots in the national capital Delhi completely sealed off for public movement. The wearing of masks made mandatory in Delhi and Mumbai. Supreme Court orders the free testing of coronavirus at approved private laboratories, says the private hospitals, including laboratories, have an important role to play in containing the scale of the pandemic. Active corona cases in the country cross 5,000. More than 400 infected persons discharged after recovery. The death toll stands at 166. Several states witnessed spike in the new cases in the past 24 hours. Maharashtra sees active corona cases past 1,000, while Delhi and Tamil Nadu also witnessed big jump in the positive cases. In Delhi, around 30 healthcare workers, including doctors, nurses and technicians at the AIIMS Cardio Neuro Center, advised to undergo quarantine. In international news, the US and UK continue to record number of fatalities due to COVID-19, while the worst affected New York records 779 deaths. The UK records nearly 1,000 deaths. That's maximum single-day fatalities so far. WHO responds to repeated criticism by the US President Donald Trump. The organization chief says it's not a time to politicize the issue. With the global COVID-19 death toll crossing 84,000, the UN is set to hold a special meeting to discuss the crisis today. And first up, let's take stock of the developments in India, Ground Zero. Now, with the number of coronavirus cases rising to 343 in Uttar Pradesh, the state government on Wednesday said all the COVID-19 hotspots in 15 districts will be sealed till the 15th of April. Replying to a question on whether the ongoing lockdown will be extended till 30th April, the official said that no decision has yet been taken on the issue. The Additional Chief Secretary Information Avnish Awasthi said that 15 districts including Agra, Lucknow, Ghaziabad, Gautam Budh Nagar, Kanpur, Varanasi, Shamli, Meerut, Bareilly and Bulandshahr have reported a number of COVID-19 cases. The hotspots in these districts will be completely sealed and only medical vehicles will be allowed and no one will be allowed to perform any other activity. The decision was taken on the directive of the Chief Minister Yogi Adityanath after he held a review meeting in Lucknow.
जिन जिलों में 6 या 6 से अधिक कोरोना के केसेस हैं, जो 15 जिले हैं, वहां पर उन्होंने ये निर्देशित किया है कि वहां के हॉटस्पॉट्स को आइडेंटिफाई करके उन हॉटस्पॉट्स में बहुत ही सख्त व्यवस्था लागू की जाए। उन हॉटस्पॉट्स में डोर टू डोर मैनेजमेंट किया जाए। 15 जिलों के इन हॉटस्पॉट्स के अंतर्गत जो थाने हैं, वहां पर जो है विशेष रूप से हमें जन सहयोग लेकर 100% जो है लॉकडाउन का पालन करना पड़ेगा। जो थोड़ी बहुत भी रियायत थी वो रियायत नहीं रहेगी और हम बहुत क्लियर करना चाहेंगे कि इन 15 जिलों के इन हॉटस्पॉट्स के अलावा बाकी जगहों पर जो है जो लॉकडाउन की प्रक्रिया अभी तक लागू है वो एज इट इज रहेगी। लेकिन कहीं किसी को पैनिक करने की जरूरत नहीं है, कहीं अनावश्यक किसी को जो है परेशान होने की जरूरत नहीं है।
Now, with the 93 new cases being reported in the national capital Delhi in the last 24 hours, the Delhi government has sealed places in which, in fact, those have been identified as hotspots. A total of 20 hotspots have been identified in the national capital Delhi, and according to the Delhi government, no one will be allowed to enter or exit from these areas. The government will also ensure the delivery of essential items in areas that have been sealed to combat the COVID-19 spread. The government has also made wearing of masks mandatory in the national capital, Delhi. And in view of the rising number of COVID-19 cases from Indore, Bhopal and Ujjain in Madhya Pradesh, Chief Minister Shivraj Singh Chauhan has ordered complete sealing of these three districts. No movement will be allowed here and the essential services will be provided by the government. The Chief Minister has also warned that FIRs will be registered if a person hides the fact that he or she has contracted the virus or even has any symptom. The death toll due to coronavirus in the state now stands at 29, with 21 persons dying in Indore alone so far, besides 5 in Ujjain and 1 each in Bhopal, Khargone and Chhindwara. The pandemic has now spread to 16 districts of Madhya Pradesh. Meanwhile, the Uttarakhand government has said that the portals of the Char Dham will be open on scheduled date, but the yatra will be regulated during the lockdown as per direction from the centre.
हमारे 4 मंदिर हैं जिनको हम 4 धाम मानते हैं, जिसमें यमुनोत्री, गंगोत्री, केदारनाथ और बद्रीनाथ। हम लोगों ने ये निर्णय लिया है कि जो चारों मंदिर हैं, जिसमें यमुनोत्री, गंगोत्री हमारे 26 तारीख को खुलेंगे इनके पट, और 29 तारीख को केदारनाथ के पट खुलेंगे, 30 तारीख को बद्रीनाथ के पट खुलेंगे। इन मंदिरों का एक शुभ मुहूर्त निकाला जाता है और शुभ मुहूर्त पे पट खोले जाते हैं। जहां तक यात्रा का सवाल है, उसके संदर्भ में मैं ये बताना चाहूँगा जनता को कि यात्रा के बारे में जो मोदी जी के निर्देश होंगे, जो केंद्र सरकार के निर्देश होंगे, उनका पालन किया जाएगा।
And the Haryana government has also in fact taken tough measures to fight COVID-19. It has also come to the rescue of the poor people as far as their ration is concerned.
हमने गरीबों की सहायता के लिए घोषणा की है कि हर सप्ताह 1000 रुपया गरीब के परिवार में पहुंचे, ताकि जब तक ये कोरोना का प्रभाव है कम से कम 2 समय का भोजन वो कर सके। हमने जो हमारी पीडीएस की दुकानें हैं, फेयर प्राइस शॉप्स हैं, उसमें खाद्य आपूर्ति विभाग की ओर से 2-2 महीने का, यानी 1 महीने में डबल राशन ये भी मुफ्त में देने का प्रावधान किया है, ताकि सब गरीब परिवारों को वो राशन समय से पहुंच जाए, अपने घर में कम से कम खाना बना करके वो 2 समय का भोजन करके सो सके। ये काम भी हमने उनके जिम्मे लगाया है।
So all the states are ramping up efforts as far as containment measures are concerned, fighting COVID-19. And as the coronavirus outbreak continues to infect more and more people, the government is taking stringent measures to contain the spread of the virus. Several states, including Delhi and Uttar Pradesh, have identified hotspots that will be completely sealed off. The movement will be restricted to the minimum in these hotspots. And let's now take a look at this graphic to explain to you what is allowed and what is not allowed in these hotspot areas. First, let's talk about what's allowed. So, well, those services include the home delivery of essential items. Those are vegetables, milk, groceries, medicines by delivery personnel authorized by the government. And also, in fact, going to hospital in case of medical emergency is also allowed. But what's not allowed is the opening of shops, banks, ATMs, post offices, or going out without a valid government pass. In fact, even walks in the parks, common areas, and entering sealed zones or gathering inside it is definitely not allowed. And to get more inputs from Maharashtra, we're joined by correspondent Shama Mishra, who is joining us from Mumbai at this moment. In fact, Shama, Maharashtra being the worst affected, reporting the most coronavirus deaths. That stands at 72 right now. Total confirmed cases at 1,135, out of which 117 are cured or discharged. You know, clearly the worst affected state in the country, battling COVID-19 outbreak. You know, even as we speak, the focus and the need of the hour clearly is on enhancing the containment measures for every state across the country. Just give us a sense of the situation there in Maharashtra as we speak today this morning.
Well, yes, the numbers are really concerning, and the entire state, amongst the entire state, the Mumbai area is the hotspot of the entire new cases that are happening, that are developing every day. So, containment, as you said, is the need of the hour, and we have seen that BMC, along with the state government, has created almost 240, more than 240 containment zones, and under this, there have been sealing of area, lockdown, and nobody can come out or go from that particular area because one or two cases from one particular area and the entire area is sealed. After that, the BMC and the fire brigade department does the sanitization of the entire area. So likewise, the BMC on their Twitter account are uploading the map of ward-wise every day, showing how the worst affected wards in the state, in the city are there. Of that, the GS ward, that is the Worli Kolivada area, is the worst affected, and that is having more than 140 cases. Likewise, they have showed the entire city. In Maharashtra also, we are seeing that the containment zones, the isolation wards, quarantine wards, they are being set up. And we saw yesterday, Maharashtra Chief Minister Uddhav Thackeray spoke to the people of Maharashtra. He addressed through Facebook Live, and he did mention that now wearing a mask whenever you step outside your house is necessary, is compulsory, and those who are found without mask would be booked. So police now are on their, they were earlier also doing an excellent job by ensuring that the lockdown is imposed properly in a, in a pleasant manner. There, those who are coming out of their house unnecessarily, they are being investigated and they are being booked. So now wearing a mask is compulsory in the state of Maharashtra. Also, we are seeing, the 3 stages, the 3 steps of using the medical resources judicially. We also saw the center saying to all the states that there should be a 3, classification. So Maharashtra has also done that. One center is for the suspects and those who are not having the symptoms. Second one would be, those showing the symptoms, positive patients. And the third one, the hospitals for having serious cases requiring advanced management. So these hospitals would be having all the ventilators, all the equipment, necessary equipment. And we did see yesterday, Maharashtra Chief Minister mentioned that there is no shortage of ventilators, medical equipment, and he also urged all these people, whether retired or who have received medical training earlier, should come forward, and he has given an email ID so that they could get in touch with the state government, and these people can come forward to serve the state, because right now we are seeing a lot of pressure has been built on the resources. So to use the resources judicially and so that the entire resources is breathing properly, these measures are being adapted.
Sure. Shama, identifying hotspots is another initiative in the series of measures that have been introduced by the state governments, and various states have identified hotspots where, of course, the containment measures will be further enhanced. And talking about Maharashtra, which is the worst affected state in the country, how many hotspots have been identified, and what measures are you seeing on the ground being enforced to make sure that these hotspots adhere to these containment measures?
Well, however, the hotspots and containment zones we are seeing in the COVID-19, and these measures, the measures that you've asked, like I've already mentioned, that containment zones are being sealed, the hotspots are being investigated, they are being observed properly, and these also include the slums area, the chawls area, because in Maharashtra, a lot of places have chawls. And in one particular story, one particular store, there are n number of homes, and the homes are small, and there are many people inside that. So yes, these people have been asked to maintain social distance. However, if that is not a possibility, then they should be using all the guidelines that has been given, that has been issued by the state government. The containment zone after the hotspot and the containment zone after they have been sealed and locked down. So these people are also being the squads from the health work.
Sure.
And they ask people whether they have symptoms, they are being surveyed, and if some people are found, then they have also been asked to,
Okay,
they have
Shama.
been shifted to institutional quarantine facilities.
All
Those
right,
are
Shama.
having high and low risk contacts.
Sure. Okay. All right, Shama, thanks very much for joining us for the moment and sharing all those inputs. We'll, of course, keep coming back to you and get regular inputs from various states across the country as to how really the containment measures are being enhanced, are being enforced to battle COVID-19. Meanwhile, around 30 healthcare workers, including doctors, nurses and technicians at the Cardio Neuro Center in AIIMS in New Delhi have been advised to undergo quarantine after a 72-year-old man who visited the facility with neurological problem tested positive for COVID-19 on Wednesday. The patient had reported to the emergency with a brain stroke symptoms around 2 days back and was immediately shifted to the neurology ward for evaluation and treatment. The patient was immediately transported to the AIIMS Trauma Center that has been converted into a dedicated COVID-19 hospital, and contact tracing has been initiated. And the number of active COVID-19 cases in the country now stands at 5,095 according to the data released by the Ministry of Health and Family Welfare today. 166 people have lost their lives unfortunately to the disease, and as many as 472 people have been cured or discharged, and one has even migrated. Let's now in fact tell you the highlights of the press conference that were addressed by the Health Ministry and the Home Ministry officials on COVID-19, and those announcements included a series of measures being taken by both the central and the state governments to break the chain of transmission. In fact, also responses have been escalated as per the ongoing increase in cases noted across the country. And states have been asked to ensure adequate COVID-19 care centers in place across the country. And it has also been made sure that there is adequate stock of hydroxychloroquine in the country, and in the near future there won't be any shortage of the medicine. In fact, HCQ can be used only on doctor's prescription, and the government, remember, is working on a war footing, adopting a two-pronged approach which includes lockdown and containment measures. In fact, the centre has also told states to continue its focus on building hospitals and on surveillance and contact tracing. While our corona warriors are working day in and day out to ensure the safety of citizens, and one of those are Anganwadi workers. Our correspondent Vishal Barrister spoke with the Anganwadi workers who are going to every locality to spread awareness and facilitate the residents.
I'm here at the Bani Park colony of Jaipur, and I have with me our nursing team. They are the medical staff here, and they are doing door-to-door survey. Let's ask them and find out what are they up to. She is an ANM. कितने लोग हैं आप लोग एक टीम में? कितनी टीम्स हैं?
हम अभी 24 जन हैं।
24 जो लोग हैं बनी पार्क इलाके में।
हाँ जी, हमारे स्टाफ के तो हम 12-13 जने थे, लेकिन बाहर से भी स्टाफ आए हैं, कहीं कोटपुतली से आए हैं, कोई हमारे आशाएं हैं, उनको भी हमारे साथ ले लिया।
Let's talk to them more. ये क्या फॉर्मेट है आपके पास और इसमें क्या क्या देख रहे हैं आप?
हम इसमें ये देख रहे हैं, परिवार का नाम लिख रहे हैं, एड्रेस लिख रहे हैं, उनकी एज लिख रहे हैं, कितने सदस्य हैं वो लिख रहे हैं। मान लो किसी को घर में बुजुर्ग रहते हैं, इमरजेंसी रहती है, जैसे दवाई चल रही है, हाइपोटेंशन की चल रही है, या बीपी शुगर की, हार्ट की, सांस लेने की, जो भी दवाएं चल रही है उसके लिए भी हम बताते हैं कि उस जगह पे पहुंच आ जाओ.
So there you heard, they are registering the names of the members in the family, the age group, and also if there is any symptom of fever or cough or cold, then they should immediately contact to the nearest hospital, and they are serving it on daily basis. एक दिन में कितने कर रहे हैं आप?
100 घर करते हैं.
So the 100 houses are being under the scanner, and they are being registered on this paper, and all precautionary measures are being taken. Vishal Barrister for DD India, Jaipur.
And in a major decision, the Supreme Court has directed that the COVID-19 test in approved government laboratories or private laboratories should be conducted free of cost, and that the centre should immediately issue directions in this regard. The top court has further said that tests relating to COVID-19 or coronavirus must be carried out in the NABL accredited laboratories or any agency approved by the WHO or the ICMR. Supreme Court has added that the private laboratories have an important role to play by extending philanthropic services in this hour of national crisis. The top court has issued directions on a PIL seeking a direction to the centre and the authorities to provide free-of-cost testing facility for COVID-19 to all the citizens of this country. And Prime Minister Modi has replied to the thank you message by US President Donald Trump for India's decision to supply hydroxychloroquine, the HCQ, to the US. In a tweet, Prime Minister Modi has said, I quote, "Fully agree with you, President Donald Trump. Times like these bring friends closer. The India-US partnership is stronger than ever. India shall do everything possible to help humanity's fight against COVID-19. We shall win this together," unquote. And remember, earlier the US President Donald Trump had thanked India and Prime Minister Modi for the decision to allow the export of malaria drug hydroxychloroquine to the US. And taking to Twitter, the US President had said, I quote him here, "Extraordinary times require even closer cooperation between friends. Thank you, India and the Indian people, for the decision on HCQ will not be forgotten. Thank you, Prime Minister Modi, for your strong leadership in helping not just India but humanity in this fight," unquote. And earlier on, Brazilian President Jair Bolsonaro had also thanked Prime Minister Modi and the people of India for timely help to its people in this time of crisis.
We have more good news. As an outcome of my direct conversation with Prime Minister of India, we will receive raw material by Saturday to continue our production of hydroxychloroquine so that we can treat patients of COVID-19 as well as of lupus, malaria and arthritis. I thank Prime Minister Narendra Modi and the people of India for such timely help to the people of Brazil.
And let's now move on. We're taking a look at some of the updates that inspire hope and positivity in tackling the coronavirus outbreak. And while there may be restrictions on movement, but there are no restrictions to creativity. As people are locked down in their houses, many of them are coming up with unique ways to spread awareness about the fatal disease. One such incident was witnessed by Moradabad on Wednesday. And on the occasion of Hanuman Jayanti, theatre artists dressed up as Lord Hanuman and asked people to stay at home and celebrate the occasion at their homes. They recorded their videos in the Hanuman avatar and shared it with people, urging them to stay home and stay safe. And moving on now to stories from across the globe on tackling COVID-19 pandemic. And a day after US President Donald Trump criticized the World Health Organization for being too focused on China, the WHO head has defended handling of the coronavirus pandemic. Speaking at a news briefing, the WHO director has called on the leaders to not politicize the virus or use it to score political points. He repeatedly called for unity and said that the organization is close to every nation and is not colorblind. Trump on Tuesday had said that he would consider ending the US funding for the agency. The president has even accused the WHO of being very China-centric and said it relied on faulty data from China about the outbreak of the coronavirus. And well, that's all that we could pack in for you in this edition of Tracking COVID-19, but our continuous coverage, news and updates on coronavirus outbreak and the containment measures being taken across the country continues here on Doordarshan News and DD India. But for now, thanks for being with us.